My name's Paul Williams and this is the hospital that I run in Bwindi, Uganda. 6 months ago I made the long journey to attend the SNAP conference in Boulder. I spoke about how we have the ability to affect real change here in Africa through relatively simple interventions like mosquito nets to prevent malaria and how we can stop babies being born with HIV. I shared how our work has empowered local people to make a real difference to their own communities, and how a relatively small amount of money can change the lives of thousands of Africa's poorest. A lot's changed since then. Much of the world has experienced financial meltdown, which has hit hard, but as usual it's the poorest of the poor who've suffered most. Food prices have risen and the number of children coming to the hospital with malnutrition has increased. But I want to continue with the message of hope that I shared with you at SNAP. We've made excellent progress in Bwindi in the last 6 months. We now have more than 1,000 people on HIV treatment in 5 different locations. And the number of women giving birth in the safety of the hospital instead of risking their lives at home in remote villages is increasing every month.
Amazina ganje lifungirwe jari. Katate wahikayo omwene basa kushanga no munasa taliyo.
Teka kuwonjizana baza kukwata wonji.
No basa kushanga munasa taliyo kandi kuzayo no kugura hihi buli kimwe mbwene.
Many of the people who I met at SNAP inspired me to return to Uganda to continue my work to improve health and healthcare in the Bwindi area. Some people gave donations, for which all of us here in Bwindi are extremely grateful, and many others pledged their support in the future. When I returned from SNAP, enthused by the goodwill and commitment of the people that I met in Boulder, I started to lay the groundwork for bringing a micro-health insurance scheme to Bwindi. We have a duty to spend every dollar that we give to Africa on projects that are sustainable. Health insurance will enable these proud people to contribute towards the costs of their own healthcare. Many people have already organised themselves into groups in order to subscribe to this scheme. They'll pay around $3 per person each year and a further 50 cents each time they come to the hospital, regardless of the actual cost of treatment. I hope that if we can pull this off, we'll revolutionise healthcare in Bwindi. People will pay when they're well so that they can get the help that they need when they're sick. The poor will be able to plan for healthcare costs rather than having to sell property when they need treatment. And instead of people being passive, grateful recipients of charity, I hope that they will become proud, maybe even demanding consumers.
George. I work here at Bwindi Community Hospital. First of all, I was employed as an expert patient, just meaning that I tested positive and I admitted that positive and disclosed it. When I tested first in 2005, my CD4 was 87. Now at present in 2009, my CD4 is 1050. I weighed, when I was testing for HIV, I had lost my weight and from 62 to 45. Now my weight has raised to 66 kilograms. So I praise ARVs, I praise disclosure. In fact, all this has been done because I disclosed it. That's why I started getting some help from other people, even help from the hospital.
Over the 3 years that Vicky and I have been here, we've seen the hospital develop expertise in reaching and helping people to help themselves. We have know-how and experience that really counts. For me, the deepest motivator of all is when I see people like George, who would otherwise be dead if it wasn't for the drugs he was taking, who's now empowered to help his own community. He shows me why we need to be here. We can't walk away saying that charity begins at home. We need to help more people like George to help themselves.